Barrett's esophagus. Barrett's esophagus is a condition that occurs when the normal esophageal mucosa of squamous epithelium transforms to columnar epithelium due to reflux of gastric contents. In this animation, we will show you how Barrett's esophagus develops and how it can lead to carcinoma. Let's take a look at the anatomy involved. We will focus on the lower esophageal region. In the esophagus, swallowed food is pushed down towards the stomach through a series of muscle contractions called peristalsis. The lower esophageal sphincter serves as a barrier between the esophagus and the stomach. When functioning properly, the lower esophageal sphincter is normally closed. It relaxes briefly to allow food to enter the stomach and then quickly closes again. The stomach contains a mixture of strong gastric acids that digests and dissolves food. When the lower esophageal sphincter is unable to close properly, gastric acid can flow back or reflux into the esophagus, damaging the esophageal lining, causing pain and discomfort. This condition is called gastroesophageal reflux disease, or GERD, and more commonly known as heartburn. Let's take a closer look at the lower esophageal sphincter. Notice the continued flow of gastric contents refluxing back into the esophagus. The constant flow of gastric contents affects the normal squamous epithelium. Over time, prolonged reflux can erode the esophageal mucosa, promote inflammatory cell infiltrate, and ultimately cause epithelial necrosis. This chronic damage promotes replacement of normal squamous epithelium with metaplastic columnar cells containing goblet cells. This condition is known as Barrett's esophagus. Although an adaptive response of the esophagus, it is a pre-malignant condition as well. Approximately 2% of patients with Barrett's esophagus will progress to dysplasia each year. Dysplasia occurs when further changes result in increased epithelial proliferation with atypical mitoses, nuclear hyperchromasia, irregular cell shapes and sizes, and increased nuclear to cytoplasmic ratios. Dysplasia can be either low-grade or high-grade, depending on the severity of cellular change. Dysplasia is considered a pre-invasive lesion. When neoplastic epithelial cells invade the lamina propria, it is then considered to be an invasive intramucosal carcinoma.